It can hardly be a surprise that a large event with social distancing and masks not much of a consideration would yield positive coronavirus cases. Yet, the reality is more than just some. 20% of the new positive cases identified in August stretch back to the Sturgis Motorcycle Rally that same month. There were 1.4 million new cases of COVID-19 reported between August 2 and September 2 in the United States. Researchers from San Diego State University's Center for Health Economics and Policy Studies found that around 20% of those can be traced back to the motorcycle rally. Bear in mind that 460,000 people attended over 10 days, and all those people took whatever they picked up in Sturgis home with them, whether it was a t-shirt with a logo or a deadly virus. Most of those attending the event did not wear masks or socially distance. Cell phone location tracking data that had been kept anonymous showed the researchers that most of the attendees were from out of state. Only 29% resided in South Dakota and bordering states. This means the virus was conceivably carried back to Arizona, California, Colorado, Iowa, Minnesota, Nebraska, Washington, and Wyoming, states that many rally attendees called home. In all, cases in 12 states and more than 100 cases in South Dakota have been linked to the motorcycle rally. Taken together, the results provide strong evidence that the Sturgis rally appears to have been a superspreader event for COVID-19, reported the researchers. We find significant case increases within the state of South Dakota as well as increases extending to counties from which relatively more residents attended the event. A man in his 60s from Minnesota who was at the rally was later hospitalized for COVID-19. The head of infectious disease for the Minnesota Department of Health, Chris Eresman, reported that he died in the past week. More than 45 cases in the state have been attributed to the rally. It's definitely frustrating because we certainly aren't surprised to see cases, said Eresman. Experts say the number of cases will probably never be clear. More than 250,000 cases of COVID-19 were traced back to the rally. The researchers estimated that they generated public health costs of approximately $12.20 billion. The researchers noted, this is enough to have paid each of the estimated 462,182 rally attendees $26,553.64 not to attend. South Dakota officials were dismissive of the report, noting it hadn't been peer-reviewed. At this point, the results do not align with the impacts of the rally among attendees in the state of South Dakota, said epidemiologist Dr. Joshua Clayton. I think it's still a little early to really know how this is going to play out, said Dr. Marcus Placia, the chief medical officer for the Association of State and Territorial Health Officials. Noting that many health departments are already having difficulty working with contract tracing, Placia added, then you bring in somebody who may have had contacts in one state and then potentially on their way back to their state of residence. He went on to say, it's very, very challenging, this intrastate travel issue. Donald Trump ally South Dakota Governor Kristi Noem, R., encouraged people to attend the rally. She has resisted the policy decisions other governors have made, not requiring masks in public and not limiting large gatherings.